Hello students, welcome to the anatomy recall session for the recent INI-CET exam. So I am your Dr. Raviraj, your anatomy faculty. So anatomy questions I'm saying, anatomy questions were damn easy. The only thing is only one twist was given about the action of rhomboideus muscle. Apart from that, all the other questions were direct questions only, very easy questions. Now we got one question from the embryology. Now the SRY gene location was asked. So SRY gene is the sex determining region in the Y chromosome, that is the gene for the male development. And I hope you know that SRY gene, which is stimulating two cells, the Sertoli cells and the Leydig cells. The intercell cells of Leydig, they secrete testosterone, and the Sertoli cells secrete MIF. I hope you know that. So now the question is not about their stimulation. The question is the location of the SRY gene. Now the SRY gene is located in the, please remember, the distal end of short arm of the Y chromosome. That is the question. But luckily in the question, they didn't mention about the distal or proximal. But the next time when they give this question again, they will twist this question with proximal end and distal end, long arm and short arm. Okay, so please remember the SRY gene is located in the distal end of short arm of the Y chromosome. So answer, it is the Y chromosome and it is the short arm of Y chromosome. Next time again I am saying 2023 November or 24 INI-CET, they will give you this question again and they will add the word distal. Distal end of short arm of the Y chromosome. That is the location of SRY gene. Now come to the second question. Now second question, arrange the neural columns in medial to lateral order in the floor of the fourth ventricle. Now neural column topic, again very important topic. Very often we are getting this question, high yield topic for our INI-CET and also the NEET exam. Now this is our neural tube. Now inside the neural tube, yes, we have the cavity. Now this is a line. This line is called sulcus limitans. Now the sulcus limitans dividing the neural tube into anterior part and the posterior part. Now anterior is basal and the posterior is alar. Now basal is motor and the alar is sensory. Okay, so all the sensory nucleus are present in the alar part, posterior part. All the motor nucleus are present in the basal plate, anterior. Now in the fourth ventricle, the cavity is an open cavity, not a closed cavity. So open cavity means, now this is, see my finger, now my thumb is anterior, now my index finger is posterior. Now in the fourth ventricle, it is an open cavity. Now see here, the cavity is opening here like this. So now one I am saying anterior, no, that is basal plate, that becomes medial and the posterior one becomes lateral. See, the cavity is opening. So basal plate becomes medial and the alar plate becomes lateral. That is what we are seeing here. Okay. Now between the motor and sensory, this line is our sulcus limitans. So this is motor, efferent column or the medial columns and the afferent columns or the lateral columns. Now arrangement question was given. Sequential arrangement was a question. Okay. So from medial to lateral, the medial most column is our general somatic efferent. Medial most, followed by special visceral efferent, followed by general visceral efferent. This is the order from medial to lateral for the efferent column or motor column. General somatic efferent, followed by special visceral efferent, followed by general visceral efferent. Okay, sir. Now what about the afferent? The afferent column, the medial most one, afferent column, the medial most one will be general visceral afferent, followed by special visceral afferent, followed by general somatic afferent, followed by special somatic afferent. Just remember the order, what I taught for the neural columns. I followed the same order. The same order only they are arranged from medial to lateral. If you remember the order, what I taught, that is more than sufficient. Easily you can answer the question. Okay. Now next time they will ask about the nucleus. Now this is the sequential arrangement question. I told you already the main model discussions. The sequential arrangement questions minimum 2 to 3 questions will be coming for your INI-CET exam. Every year they are giving 2 to 3 questions. Even this year INI-CET exam, they gave 2 questions in the sequential arrangement pattern. Okay, right. Now see this question. Arrange the neural columns in medial to lateral in the order of the floor of fourth ventricle. I told you the medial most one will be the general visceral afferent. That is the medial most. Then special visceral afferent, followed by general somatic afferent, followed by special somatic afferent. It is the order of arrangement from medial to lateral for the afferent column. All were afferent only. Okay, right. That is the answer for this question. Right. Now next question. Another sequential pattern question. Again, there is a new question, very old question. 2018, 2019 AIMS exam, we got this question. 2020, 21, we didn't get this. 20, 21, 22, we didn't get this question. But 2018, 19, repeatedly they were asking this question. The arrangement of structures from peripheral to central in the auditory pathway. Okay, right. So now, again, very old mnemonic. The mnemonic is E. coli ma is a mnemonic. I hope you know that. So E. coli ma is a mnemonic to remember the structures involved in the auditory pathway. Now E is our 8th nerve. Now 8th nerve is arising from spiral ganglion. Very good. So spiral ganglion, the process axons, which in turn give rise to 8th nerve. And then C, from 8th nerve, cochlear nucleus. And then from the cochlear nucleus, fibers are projecting to superior olivary nucleus. And then these fibers, they are called as lateral lemniscus. From lateral lemniscus, fibers are given to inferior colliculus. Now from inferior colliculus, fibers are given to medial geniculate body. From medial geniculate body, fibers are given to auditory cortex. So we know the mnemonic. Mnemonic is E. coli ma. Right. Now see the question. So now from peripheral to central, the first structure is our spiral ganglion. So option B, C, D. Now option A is wrong. First spiral ganglion followed by cochlear nucleus. Not superior olivary nucleus. Cochlear nucleus. Followed by E. coli ma. ECO. O is our superior olivary nucleus, and then lateral lemniscus. So B is the answer for this question. Spiral ganglion, cochlear nucleus, superior olivary nucleus, lateral lemniscus. This is the arrangement. Okay, right. And then inferior colliculus, medial geniculate body, and then auditory cortex. And B is the answer for this question. Next one. Now, which of the following vessel is involved in the condition shown below? Now, this diagram, this is the medulla. Now, why I am saying medulla? Now, see the cavity here. See, the cavity is open here. This is the section of medulla. Now, in the medulla, where is the marking? Marking is on the lateral part of medulla. So, now, for this patient, lateral medulla is affected. The patient is having lateral medullary syndrome or Wallenberg syndrome. Now, the lateral medullary syndrome or Wallenberg syndrome is due to which artery? Vertebral artery greater than pica, posterior inferior cerebellar artery. Okay. Now, what are structures affected in the medullary syndromes? Now, in the case of medial medullary syndrome, the structures affected are hypoglossal nucleus, medial lemniscus, and the corticospinal tract. Now, what is the artery affected in the medial medullary syndrome? Very good. Anterior spinal artery. That is the artery affected in the medial medullary syndrome. Next one. Our lateral medullary syndrome. What are the structures affected in lateral medullary syndrome? Vestibular nucleus, inferior cerebellar peduncle, spinal nucleus of trigeminal, reticular formation, lateral spinothalamic tract. All these structures affected. Plus, one special structure for lateral medullary syndrome is nucleus ambiguous. Now, lateral pontine syndrome. Again, lateral pontine syndrome, the vestibular nucleus, cerebellar peduncle, spinal nucleus of trigeminal, reticular formation, and the lateral spinothalamic tract are affected. The only difference between lateral pontine syndrome and the lateral medullary syndrome is the nucleus ambiguous involvement for the medulla. Whereas lateral pontine syndrome, involvement of 7th nerve and the 8th nerve. That is what we are seeing here. See here, in the lateral pontine syndrome, the artery is ICA, anterior inferior cerebellar artery. The main nerve affected is facial nerve. Okay. So mnemonic for the lateral pontine syndrome is facial, Facial. Facial nerve involvement will be there. And the artery is AICA, anterior inferior cerebellar artery. ICA artery is affected. Now in the case of lateral pontine syndrome, yes, the mnemonic is Pica-Chu. That is Pica can't chew is a mnemonic. So Pica means posterior inferior cerebellar artery, Pica artery. Can't chew means dysphagia. So artery affected in the lateral medullary syndrome is, yes, Pica artery, and the patient will have dysphagia due to nucleus ambiguous involvement. Okay. So now what is the answer for this question? So the image they gave the lateral medullary syndrome or Wallenberg syndrome. The best answer is vertebral artery, but vertebral artery is not given. Then what is our answer? Posterior inferior cerebellar artery. That is the answer for this question. Okay. Next one is a very easy question. They gave the match the following type. So now we have to, they gave the nerve and they gave the other end, they gave the options. So now we're going to see the options first. Now glossopharyngeal nerve function, glossopharyngeal nerve which carries touch and the taste fibers from the posterior 1/3 of the tongue. Okay. So for A, the answer is 2. So now B and D, yes, the options are right. Now spinal accessory nerve. Spinal accessory nerve, we know already that nerve supplies 2 muscles. What are those? Sternocleidomastoid muscle and trapezius muscle. So trapezius muscle, it is helping for shrugging of the shoulder. Shrugging of the shoulder means elevation of the scapula. So spinal accessory nerve function is number 1. Facial nerve. Facial nerve, so many functions are there. But here they gave taste fibers from the anterior 2/3 of the tongue. So now facial nerve 4. Mandibular nerve. Mandibular nerve, it is the nerve supplying the muscles of mastication that is helping for chewing. So answer for this question is B is the answer for this question. Actually, this question they didn't give the extended matching. Sometimes they may give more options to confuse you. The next time, yes, they may give you more option. Extended option they will give you. So answer for this question is glossopharyngeal nerve, touch from the posterior 1/3 of tongue, spinal accessory nerve, shrugging of shoulder, facial nerve, taste from the anterior 2/3 of tongue, and the mandibular nerve, chewing. Okay? Right. Now see the next question. Now which of the statement given below regarding the muscle shown in the image are correct? Actually, this is multiple answer type. Now in the image, yes, they gave what muscle? That is our rhomboidus muscle. Now just above that, we have one more muscle will be here, like this. From the scapula to the cervical vertebra, that muscle is our levator scapulae muscle. And overall, see here, I am drawing now. Yes, this is our trapezius muscle will be here. See, trapezius muscle will be covering the levator scapulae muscle, rhomboidus minor and major muscle. If you want to see the levator scapulae, rhomboidus minor, major, then we have to remove the trapezius muscle. Now, trapezius muscle action, I hope you remember. Trapezius muscle doing 3 actions. What are those? Number 1, elevation of the scapula along with the levator scapulae muscle. Trapezius muscle, the middle fibers, they are helping for retraction of the scapula along with rhomboidus muscle. And trapezius muscle along with serratus anterior, it is helping for overhead abduction. So these 3 actions are there for our trapezius muscle. On the other side, now we remove the trapezius muscle and we are seeing levator scapulae muscle and the rhomboidus muscle. Okay. Right. Now in the question, they are asking the action of rhomboidus muscle. Now we know one action. The rhomboidus muscle retract the scapula along with the middle fibers of trapezius muscle. If it is a single best answer type, then we have to select only this answer. But in the biomechanics of the shoulder joint movement, they are explaining the other actions of our rhomboidus muscle. So please underline, these are the lines given in the Gray's anatomy. The middle fibers of trapezius along with the rhomboids, they're responsible for retraction of the scapula. Single best answer means retraction of scapula is the answer. But most of the students, they are saying multiple answer type. In that case, see here, the middle fibers of trapezius, it is function as a retractor, whereas rhomboids act as a retractor, and also it rotate to depress the glenoid fossa. Second action. Functionally, rhomboids muscle retract and also elevate the scapula and rotate the scapula. So three actions are there in the biomechanics functions of the shoulder girdle. So now see the options. They elevate the scapula along with the trapezius. Yes, that is also correct. They rotate the scapula, tilt the glenoid cavity inferiorly. Yes, that is also correct. But not our last option. They rotate the scapula, tilting the glenoid cavity superiorly. Now this is done by our trapezius muscle along with serratus anterior. These two muscles will do that. So now multiple answer type means answer A, B, C. That is the answer for this question. Multiple answer type means single best answer means only one answer. A is the best answer. A is best greater than B and C. Multiple answer A, B, C. All the three are correct. Okay? Right. Now see the next question. Now next question is a repeat question. 2021 INI-CET exam, we got this question. The same question was repeated in the 2023 May INI-CET exam. Now the patient presents with abnormal sensation in the little finger and weakness of muscle in the medial palm muscles. The most probable site of injury. So now this is the humerus diagram. Now humerus, it is related to the neck of the humerus bone, which is related to axillary nerve. Strictly speaking, the surgical neck of the humerus bone related to the axillary nerve. And in the shaft of the humerus, radial nerve in the spiral groove. Shaft of the humerus fracture with radial nerve involvement, then that is called Holstein-Lewis fracture. So shaft of the humerus fracture, radial nerve involvement. And behind the medial epicondyle, yes, our ulnar nerve is passing. Okay, so behind the middle epicondyle, ulnar nerve. So now see the question. Now in the question, the patient is having abnormal sensation in the little finger. Little finger and the ring finger medial half, it is supplied by medial 1.5 fingers. It is supplied by medial 1.5 finger. It is supplied by ulnar nerve. And also the medial palm muscles, that is hypothenar eminence muscles, they are supplied by ulnar nerve. So now they are asking about ulnar nerve injury. Ulnar nerve is passing behind the medial epicondyle. What is the answer for this question? C is the answer for this question. Again, repeat question of 2021 INI-CET exam. Okay. So every year in all the exams, whether NEET or INI-CET or FMG exam, they are giving one question from the nerve injuries. Okay. Right. Now again, we got this question in the recent INI-CET exam. Right. Now again, next one. The anterior relations of the third part of duodenum, all are except. So now this is the first time they are giving this question. Now the third part of duodenum in the front side, which is crossed by superior mesenteric artery and the superior mesenteric vessels. Superior mesenteric artery and the superior mesenteric vessels, they are passing in front of the third part of duodenum. Okay. So now the same superior mesenteric artery and the superior mesenteric vein, they are passing anterior to the uncinate process. The same superior mesenteric artery and the superior mesenteric vein, they go posterior to the neck of the pancreas. So all these were questions only. In 2020 NEET exam, they gave this question. The patient is having cancer, carcinoma in the uncinate process of the pancreas. Which of the following vessel will be affected? Answer, superior mesenteric artery and the superior mesenteric vein. Okay. Now again, old NEET question, FMG question, anterior to the uncinate. What we have? Superior mesenteric artery and the superior mesenteric vein. Very good. Now the same superior mesenteric vein go behind the neck of pancreas, join with the splenic vein to form portal vein. So portal vein formation is behind the neck of pancreas. Very good. Now see the question. Now here they are asking about the relations of third part of duodenum, anterior relations of third part of duodenum. Superior mesenteric artery and superior mesenteric vein, they are passing anterior to the third part of duodenum. Very good. And it is also crossed by the root of mesentery. So what is mesentery? I hope you know that. Mesentery is a peritoneal fold suspending the jejunum and ileum from the posterior abdominal wall. Now the root of mesentery, which is starting from duodenojejunal junction and it goes up to the ileocecal junction. So now while going that, the root of mesentery, it is crossing the third part of duodenum anteriorly. So root of mesentery is also crossing the third part of duodenum anteriorly. Right. And we also have some coils of jejunum. These are structures present anterior to the third part of duodenum. Now we also have some structures which is present behind the third part of duodenum, posterior to the third part of duodenum. Just remember this, the posterior abdominal wall structures. What are those? Our psoas major muscle, right ureter, right gonadal vessels, IVC, abdominal aorta. So all these structures, they are the posterior abdominal wall structures. They are present behind psoas major, ureter, IVC, aorta, gonadal vessels, everything. Okay, right. Now see the question. The anterior relations of the third part of duodenum all are except the root of mesentery will be there, loops of jejunum will be there, superior mesenteric artery will be there, except the fundus and body of the gallbladder. It is not related. The body of the gallbladder, which is related to the second part of duodenum, and the fundus of the gallbladder, which is lying in the transpyloric plane, which is overhanging the transverse colon. So fundus of gallbladder, which is lying in the transpyloric plane. Transpyloric plane, I hope you know that. There is a horizontal plane at the level of L1, lower border of L1. Yes. So answer for this question is all are except our fundus and body of gallbladder. It is not related to the third part of duodenum. Right. Now one last question. Which are the following muscles supplied by superior gluteal nerve? Multiple answer type question. So now here actually saying, strictly speaking, all the four are supplied by our superior gluteal nerve. Superior gluteal nerve supplies, we know, gluteus medius, gluteus minimus and tensor fasciae latae muscle. See here, this is our superior gluteal nerve. The superior gluteal nerve is emerging. It is a branch of sacral plexus. Root value, they won't ask you. Root values are old questions. Now the new format, we are not getting any question about the root value. For the completion sake, I am saying root value for superior gluteal nerve is L4, L5, S1. Similarly, inferior gluteal nerve, L5, S1, S2. Root value for inferior gluteal nerve. Now superior gluteal nerve, inferior gluteal nerve, they are the branches of sacral plexus. Now superior gluteal nerve emerging above the piriformis and supplying gluteus medius, gluteus minimus and the tensor fasciae latae muscle. This is what we know. That is what given in the Gray's anatomy too. Superior gluteal nerve, branch of L4, L5 and S1, accompanied by superior gluteal vessels, leave the pelvis via greater sciatic foramen above the piriformis. Divide into superior and inferior branches. They supply the gluteus medius, gluteus minimus and tensor fasciae latae. That is what given in the description of superior gluteal nerve. That is what we are telling in the classes. Superior gluteal nerve supplies gluteus medius, gluteus minimus and tensor fasciae latae muscle. Okay. But in the piriformis explanation, they gave this in the recent Gray's anatomy. They have added this. Piriformis in the old edition books, they are mentioning it is supplied by branches from S1, S2. In the recent edition book, they are given piriformis is innervated by our superior gluteal nerve. In the recent edition Gray's, they have added this. Okay. So piriformis is supplied by our superior gluteal nerve. So all the four muscles are supplied by our superior gluteal nerve. But in the options, luckily, they are giving only 3 options. So now piriformis, you can keep the piriformis muscle as a plus or minus option for the superior gluteal nerve supply. Superior gluteal nerve mainly supplies 3 muscles, gluteus medius, minimus and tensor fasciae latae. Now please keep these 3 as a main answer. Piriformis, it is mainly supplied by fibers from S1, S2. Piriformis nerve supply means, please remember, it is supplied by S1, S2 greater than superior gluteal nerve. Okay? Right. So now, superior gluteal nerve supply means, please remember gluteus medius, minimus and tensor fascial latae muscle, and please remember the piriformis muscle as a plus or minus option for the muscle supplied by superior gluteal nerve. Okay? So now they are asking 3 best answer means, now 3 best answer is A, B, C is the best answer. I told you piriformis plus or minus option. In that case, we can omit the piriformis. So answer is A, B, C. 4 answer means all the 4 are correct. Okay? So 4 answer means all the 4 are correct. Gluteus medius, minimus, tensor fascial latae and piriformis are correct. So now they are asking only 3 best answer. In that case, we can go for medius, minimus and tensor fascial latae. Right? Right. So now, yes, these are all the questions we got in the INI-CET exam. So I told you already, only one question was tough. That is our rhomboidus muscle action was bit tough. Again, in the main description about the rhomboidus muscle action, they mention only the retractor function. But in the description about the individual biomechanics, they added those points. That is a difficult question. Remaining all other questions were very easy questions, straight questions. Okay? Right. So these are the questions we got from the anatomy. So thank you so much and see you in the next session. Good luck and the best wishes.